It's very normal to be afraid or nervous about having a colonoscopy. Most people are because it is an invasive procedure and you are sedated during it. I think the benefits of having a colonoscopy and preventing colon cancer far outweigh any of those concerns, and I think it's just so important to get it done.
My name is Nicole. I'm a GI technician here at Cooper University Healthcare. I work in endoscopy, and my job here is to assist the physicians for colonoscopies and upper endoscopies.
Hi, I'm Apeksha, and I'm a gastroenterologist at Cooper University Healthcare, and I perform screening colonoscopies.
Prior to your prep, you'll get instructions. You'll be on a diet restriction where you can only eat certain foods. So you want to stay away from high fibrous foods such as popcorn, seeds, fresh vegetables. One day before, you have to be on a clear liquid diet. And the reason why is because we need you to flush out 5 feet of colon. So the clear liquids, we want to go with the Gatorades. You want to stay from anything red or purple because in the colon, it looks like blood.
Things that I consider when deciding which preparation would be best for you would be whether you have underlying bowel conditions like previous surgeries or if you're constipated, in which case I may need to use a more aggressive prep to ensure that everything's cleaned out well.
Prior to receiving anesthesia, we require that you have a ride to take you home. You're going to be groggy and still under anesthesia, so we want to make sure that your safety is priority for us. So we ask that you clear your schedule for the full day and just rest.
Prior to the procedure, you do want to take medications that are used to control your blood pressure or heart rate, along with any inhalers that are used to manage lung disease. We want to make sure that your heart and lungs are in the best shape possible before we put you under anesthesia. Other medications that you may use on a daily basis, such as heartburn medication or psychiatric medications, usually are okay to take after your procedure and are pretty safe to be held until that time.
We just ask that the patients wear loose-fitting clothing, no jewelry, something comfortable to come in because they're going to be putting those clothes to go out while they're still under anesthesia. You'll come in and you will sign your forms, consent forms and HIPAA forms. From there, your nurse will then come and grab you and take you to preop, which will be your first stop here. We ask that you remove everything from head to toe and place on a gown and booties. Then from there, you will speak with our physician and anesthesiologist prior to going back for your procedure.
When I meet you in the pre-op area, we'll be going over the procedure in detail. We'll also go over any further details of your history, including any other gastrointestinal issues that you may be having that I can evaluate during your colonoscopy, along with an extensive family history to make sure that we know if anybody does have colon cancer.
They'll let the team know that they're all ready to go, and we'll take you to the back to the procedure room.
When you enter the procedure room, you'll be introduced to all of the staff, including our nurse anesthetist, the nurse in the room, our technician, and you'll have already met me.
So we ask you to lay onto your left side, right knee over the left, just like you're at home watching a football game.
Once you're in position, you'll start receiving anesthesia through the IV, and you'll be put to sleep. The first step in doing a colonoscopy is doing an external examination, so I'll do a rectal exam and make sure that everything looks normal there. Once that's done, I'll insert the camera scope into your back end and take a look around the entire colon. As I'm going through the colon and coming back out through the colon, I'm looking for polyps, which are growths in the colon that can turn into colon cancer. If I do see any polyps, I'll remove them at the time of the procedure. After the procedure, I'll come meet you in the post-op area where we'll go through what I found during the colonoscopy. At that time, we'll go over any questions that you may have, along with next steps of what needs to be done based on what I found during your procedure. You should start getting a screening colonoscopy at age 45. Recently, the age was lowered to 45 based on all of our society guidelines, as we are finding that younger and younger people are developing colon cancer. People who have family members who have had colon cancer should get colonoscopies sooner. Typically, we say that you should have a colonoscopy 10 years sooner than the youngest age of diagnosis. For instance, if your dad was 50 when he was diagnosed with colon cancer, your first colonoscopy should be done at 40.
You may feel dizzy, you may feel lightheaded, you may feel hungry.
If you begin to experience really severe abdominal pain and the inability to pass gas or stool, along with things like nausea, vomiting, or bleeding, you should call our office right away in order to be evaluated. It's very common for many of the polyps to have precancerous cells, and in that setting, we know that that precancer has been removed at the time of the colonoscopy, and because you did develop a precancerous polyp, we'll bring you back sooner for your next colonoscopy. If we find a cancerous polyp or something that looks like colon cancer while we're doing your screening colonoscopy, we'll get everything in action to get you into the right hands for the next steps. That typically includes me getting in contact with a nurse navigator at MD Anderson Cancer Center at Cooper, who will help facilitate an expedited appointment with an oncologist and our colorectal surgeons to determine a plan of action for you. I think the oncologist and the rest of the staff at MD Anderson Cancer Center at Cooper are fantastic, and I would trust them with my own family. Colonoscopy is the best way to prevent and detect colon cancer.
Our goal is to catch colon cancer in its earliest stages so that we can actually set up a plan in action to care for you. If you would like to schedule a colonoscopy, all you have to do is let your physicians know. They'll then route you to a scheduler, and we'll set up a day, time, and physician for you.